There is more conversation about the idea of mandated vaccines for certain companies and agencies. Kids are headed back to school in a few short weeks, and the Delta variant is surging. So to talk about all those things, what we need to know about this point in the pandemic, we have Cherise Rohr Allegrini, a local epidemiologist, joining us today for our KSAT Q&A. Cherise, great to see you. Always love having you on. And I want to start here. We keep reminding people about the importance of getting the vaccine, trying to get more people who have not done so to make that decision. So if where we are right now, we don't see a significant number of more people getting vaccinated, what do you think the future of this pandemic looks like?
I'm afraid it's not going to end anytime soon, and it's going to make it difficult for us returning to schools. We know that we're about 45% of the total population of San Antonio and Bexar County has been fully vaccinated. That leaves a lot of people not vaccinated, including those under 12 who can't get vaccinated, and that's the most of our school population. So it does have me very concerned. You know, we all want to get back to normal, and we're not getting there.
Is that your biggest concern about the numbers that you're seeing, the fact that we just don't have herd immunity? We're not really close to herd immunity right now.
Exactly. You know, we're seeing huge jumps in hospitalizations. We were down close to 100 hospitalized COVID patients per day for a while. Now we're at almost 300. So that's a huge problem. The hospitals are still in a situation where they can handle it. So I am concerned there. But my bigger concern is that we're not going to get to a point where we can function as normal as possible unless we have something closer to herd immunity, which is, you know, it's not going to be perfect. We still don't have herd immunity for all the diseases for which we have vaccines, but we come pretty close to it. And that's what matters. So we really need to get folks who can get vaccinated.
We're hearing a lot more conversation, too, about this being a pandemic of the unvaccinated at this point. Can you talk about the impact that the Delta variant is having on people who have not gotten the shot?
Well, definitely we see that you have a higher viral load, which means there's more virus in you when you have the Delta variant and you're unvaccinated, which means you're more likely to transmit it to somebody else as well as get very sick. If you've been vaccinated and you do get infected with a Delta variant, you're less likely to transmit it. You're less likely to get very sick. That terminology, I don't like it that much to say it's a pandemic of the unvaccinated, because we are seeing some cases in those who are vaccinated who are getting the virus from people who are unvaccinated, because, again, they have higher viral loads. But then, you know, remember that not everybody can get vaccinated. So we have kids under 12 and many immunocompromised folks who don't really have a choice to get vaccinated at this time.
You are a disease detective. That's what epidemiologists do. Talk about the people that are out there and they're saying, okay, there's 300 people in the hospital. That's way less than we saw at the height of the pandemic. What do you say to those people that, you know, what do you say to those people who are skeptical that we're seeing another surge?
Well, we are seeing a surge. You can see it in the graphs. You know, it's very obvious in our data that we see a surge. 300 people in the hospital is pretty significant. Now, I said I'm not too nervous just yet because I think the hospitals are in incredibly good shape to handle what they're dealing with, but the hospitals need a break too. They need to be able to deal with flu season that's going to come up in the fall. They need to be able to deal with all the regular cases of, you know, the car accidents, the heart attacks, et cetera. And so we need to really get back. That's what has to get back to normal. It's the hospitals, absolutely, but also our schools. You know, for the last year, even though some schools were in person, many students stayed home. And so we didn't have large populations of kids under 12, unvaccinated in the same space for many hours a day, which is what we're going to see in the fall. And so that actually is my biggest concern, because you have kids that are going to be transmitting it. And even if they don't get as sick, they're going to be giving it to other people.
And I think that that's such a question for people who are fully vaccinated, but they have children, they live with someone who is not able to get the vaccine, and of course heading back to school too. So, we're talking a lot about the Delta variant right now. We've heard about the Lambda variant being discovered at a hospital in Houston. Should we expect to keep hearing about different variants popping up as we're trying to get more people vaccinated, but that number seems to have plateaued for at least now?
Right. The virus mutates, and so you are going to see new variants. How much impact those variants have is really going to depend on how successful that mutation is for the virus. The Delta variant mutations are significant enough that they're really increasing the transmissibility of the virus. They're increasing the viral load, increasing the transmissibility, and that's why we've heard so much about the Delta variant. Some of the other variants have not been as sort of successful from the point of view of a virus. And also the vaccines have worked more effectively against those. But most of the transmission we're seeing is from unvaccinated to vaccinated people. If you're vaccinated, you can potentially get infected, you can potentially get sick, but you're less likely to get very sick and you're less likely to transmit it. So even though that vaccine isn't perfect, it's still doing a wonder in preventing the spread of the virus in this pandemic.
Is that frustrating to you? As I called you a disease detective, which is what you told me an epidemiologist does, so I like to use it as often as possible. But I mean, what the solution is, or at least something that can stop this, and it's not being used. Is that frustrating for you as a scientist?
It is extremely frustrating and unfortunately not new. We've dealt with this with every outbreak, every epidemic. We're still dealing with it with HIV where we have the tools and we're not quite getting there. It's especially frustrating with COVID because it is disrupting our lives so much. I have an 11-year-old that I was planning on sending back to class in a few weeks. And now I'm getting a little bit nervous about it because he can't get vaccinated for another 5 months. And so that's a huge concern. And that's going to be a concern for a lot of families in our community. So the impact of this pandemic is so intense. It's not just the flu. And even the flu is pretty significant. So I don't like the comparisons to the flu because the flu is pretty bad as well. But it's not a mild disease and it's scary. And we're not going to get to a better place unless we get folks vaccinated. But that also means bringing vaccine to the people, making it easy for folks to get vaccinated, answering their concerns, convincing them of all the reasons why. And let me just add that I have heard from a number of folks who say because they have kids under 12 who can't get vaccinated, they don't want to get vaccinated because they don't feel it's fair. Quite the opposite is the truth, that by vaccinating yourselves, vaccinating everybody in the household that can get vaccinated, you're protecting those in your household who can't get vaccinated. And that's what's so essential in controlling this pandemic.
We have the tools. And as a reminder, like you were mentioning, bringing the vaccine to people, there have been so many pop-up clinics in all different parts of town. I know we have a list on our website right now at KSAT.com. So Cherise Rohr Allegrini, local disease detective, also known as an epidemiologist. Thanks so much, as always, for sharing your time.
Thank you so much for having me.
Take care. We'll be right back.